Hi, it's Dr. Zenn. If you're watching this video, you're probably one of the 4 million American women that have breast implants. Now, your plastic surgeon should have told you that your implants are not permanent. Why do we tell people this? Well, there's 4 reasons why. Number 1, because implants can get old, implants can rupture. Saline implants will go flat. Some of the silicone implants might leak silicone. They'll need to be replaced. Second, you can get scar tissue around your implant. That's a natural reaction to your implant, but if that gets thick or firm, breasts can start to feel firm and have deformities to them. You would want that fixed. You'd want the implants removed for that reason. Third, some of you have textured implants. Now, textured implants, we're texturing the surface of the implant so they wouldn't move. These implants are now associated with a lymphoma called ALCL, and 1 in 3,000 women are having this problem, so a lot of women are choosing to exchange them. And lastly, your implant's perfectly fine, but you're aging, your breast is aging. The implant is sitting there nicely, but now there may be breast droop, or you may have gained weight over time. So what can we do? If your implants need to be removed, you have a few options. Most commonly, number 1, people take their implants out and put new implants in. That's fine if there's no other issues of scar tissue or size. You can change your size, you can go bigger or smaller. What I generally see is most plastic surgeons will replace the implant with a larger implant to now take some of that droop away. And so sometimes people end up with bigger implants than they probably wanted, but it is a solution. Another option is that your implants are fine, the breasts are starting to droop. People can get a breast lift, literally lift the tissues back over the implant. I often combine this with fat grafting. Lastly, you can just take the implants out. And certainly we're seeing more and more women who are just like, I am done with my implants. I just want them out. The issue is that the implants are the thing providing volume to your breast. The average implant for American women is 300 cc's. That's a lot of volume. And once you take that away, the breast will definitely be flatter, and there'll be an issue of so much droop that it just doesn't look pretty anymore. The problem, while you can't just lift a breast that's empty, is it just ends up looking flat. Almost to look like a fried egg with scars on it, and people are just not happy with that. So when you take an implant out, you have to have enough volume. I think this is the one thing that prevents most women from having their implants removed, is they're afraid if I just take them out, they're just not going to look good. I'll just live with them. Well, I'm going to tell you about a new procedure that I'm doing, and it's using fat grafting to replace the implant. Fat grafting, simply put, is doing some liposuction in an area where you have some extra fat tissue, taking those fat cells, processing them. And then when we remove the implant, I then can add fat back into the breast. And I've been doing fat grafting for over 15 years, and I've learned a lot of lessons about how to get fat to survive or not to survive. The key is these fat cells need to be touching some of your natural tissue to get a blood supply. If you have a 300 cc implant, I can't just put 300 cc's of fat in. Just the surrounding bit of fat tissue touching things will get blood supply. The rest of it will die. I've seen patients come in with firm nodules and cysts and all kinds of deformities because someone just threw a bunch of fat in. So fat needs to be placed in a very specific manner. Tiny little bits of fat, I place them under the skin. I'll place them in and around the muscle. Even if you have some scar tissue that's not removed, I'll put fat there. All of that gives it blood supply. We get about an 80% survival of that fat tissue. And because we're putting tiny little bits in, the 20% that doesn't survive kind of melts away. And so we don't see any lumps, cysts, or whatever. What we don't want to do is put fat into breast tissue. That can confuse mammograms and things like that, and there's really no reason to do that. The other thing I'll do is, because a breast has so much extra skin, we need to remove the skin. And in most cases, I can remove the skin under the fold of the breast. So that's going to be the only scar that you'll have. And a lot of people have a scar there already from placing their implant. And what they'll give you is a smaller, beautiful appearing natural breast. And we can get from A cup to C cup, really depending on how much breast tissue you actually have once your implant is removed. If you are someone who is unhappy with your implants and you're thinking you really might just want to take them out, come see me at Zenn Plastic Surgery, and we can see if you're a good candidate for fat grafting.